So this is a pretty interesting case. A patient who had had previous abdominal surgery. If I'm not mistaken, this was from an open gallbladder removal, which is kind of an older way of removing that, which is a kind of a slanted incision in the upper part of the abdomen. Nonetheless, when patients have that type of incision, it can make things a little bit dicey, a little bit challenging as far as the blood flow and health of the skin following a tummy tuck. Nonetheless, obviously in this after picture, the patient got a fantastic result. I was able to remove all this kind of excess skin at the bottom. One thing I haven't really talked about much before is just as the skin from above kind of gets pulled down, once that excess skin is removed and it gets sewn in place, it gives a nice little kind of lift to the pubic area and gives a nice little kind of more youthful kind of just lift to that area. You can see things in this general region is kind of a little bit more boggy, kind of heavy. And then afterwards, things are kind of just much more taut and lifted. One other thing you can kind of follow in this particular patient's example is she has this little mole up here with a couple little surgical scars up here. And you can see afterward, those are now at the level of the belly button or even just slightly below. So if you look at a lot of pictures closely, you can see a lot of those kind of little details like moles or surgical scars and how much that actually comes down. And then all the way from the side view, things are much more flat. And that's from the muscle repair of the internal stitches that bring the six-pack muscles back together.